All right, folks, we are back. We are back. Let me get a chance to get all these things flowing again, the different sections of the network. And before we come back, I just want to let you guys know this time it wasn't the internet that went down. This time it seems like what we had was a very, very hard crash on our broadcasting network. But 6 minutes it took to recover. I don't think that is all that bad. But let me go ahead and zap us into the rest of the network and we'll be ready to proceed. So bear with me as I get ready and we are almost there. I can't leave any of these things untouched or behind. Anyhow, as we get ready to get started again, all right, we're there. Okay, Tamara, let's continue the discussion. One of the issues that I have and was very concerned about Georgia opening it too soon. And earlier in before we had our mishap, you said that your team they're professional enough to understand what's really going on in the industry. So tell me your thoughts as far as will people get hurt? Will more people get the disease? Will there be many of your beauticians and your hairstylists that don't follow the rules? Those are the things that are really concerning. Why people are think unless there's a vaccine, we're not ready to open.
I think nobody can be a predictor of what is about to happen. I think this is all uncharted waters for all of us. And as licensed, and I repeat, licensed beauty and barber professionals, a lot of your salons across the country, just to give you some insight, a lot of professionals, quote unquote, professionals, they don't have licenses. So you might want to, when you walk into a salon or a barbershop, you want to look on the wall and make sure there's first, of course, a license. They are licensed by the state to actually provide these services. But licensed professionals are trained in health and safety and sanitation and infection control. So their daily job every day when they're providing you services is to keep you safe. That's their first and foremost, that's what they're supposed to do. Beyond providing you a great service, their job is to keep you safe. So when my industry was allowed to go back to work, many professionals were ready to go back. There's some that are, waiting to see how things continue to unfold with testing here in Georgia. But a lot of our professionals were waiting and are ready to go back to work. So, Egberto, I don't think anybody can predict what is going to happen moving forward. I'm just hopeful that my industry and beauty and barber professionals will continue to do everything that they have been trained to do and adopt the additional practices, procedures, and protocols that we now have in place to keep clients and keep themselves safe.
Now, would you have preferred for the government, let's say, to until they had a vaccine or until they had a better grasp of this disease, to maybe compensate the beauticians and the folks in your industry, so that they didn't feel compelled to go back to work? In other words, do you feel like I know everybody wants to work, but do you think more than anything else they feel compelled to go back to work?
I don't think people want to sit home and not be able to feed their families when these unemployment benefits. You have an industry of professionals where independently. They have their own suites. They're independent contractors, so they work independently. Unemployment benefits were not trickling down to them. This stimulus, that money was not trickling down to them. And if we have people in our industry with child support issues or any other issues, that stimulus money wasn't trickling down. These grants and loans, that money wasn't reaching the industry. So this is an industry of, if anybody is able to go back to work, because like I said, I stand on the foundation that we have been trained in health, safety, sanitation, and infection control. So if anybody was able to go back to work, it is my industry.
So you think more so than restaurants and other places, it is okay for the beauty industry to move on?
Again, we have been trained in health, safety, sanitation, and infection control. That is a part of our training that is required for licensure. When you go to get your license, you are tested. This is not information that you just read and you think you know. Like, we're tested on this information before we can even be licensed.
Okay, well, great. I have some other issues that I'm going to talk about in the next segment about Georgia going back to work. But I'll take what you had to say in advisement for your particular industry. Other than that, how is your Senate race going?
It's coming along slowly but surely. Georgia has pushed back the primary here until June the 9th. So we are looking at another month before we'll actually have our state primary, and my race is in November. So once we get past this first primary, I'll be off and running much faster than I am right now. But I think this season that we're in, we're just everybody's kind of walking as doing as much as you can as a
It's
candidate.
not easy. Yeah, it's not
No,
easy
it's
at all.
not.
And I actually campaigning, I imagine, is going to be a difficult task for you as well.
Well, you know what? I hope and pray not. I'm hopeful, Egberto. I keep trying to be optimistic in this season. This is not going anywhere. And when you mention the vaccine, I'm not for vaccinations at all, Egberto. So I wasn't waiting for them to come up with a cure or a vaccine. We're going to continue to eat right. We're going to continue to stay healthy, stay 6 feet away from each other. Wash our hands, do all the things that keep us safe. But waiting for a vaccination, I'm not, and I know a lot of people who feel the same way.
They don't think it's going to happen, eh?
Well, if it does, I'm not. I wouldn't take a vaccine.
We are going to have to talk that on another subject at another time. But anyhow, Tamara, give me a closer before we get out of here.
I am Tamara Johnson Shealey. You can find me on Saturdays at Tamara for Georgia right here on Facebook, YouTube, Twitter. I am actually David and I broadcast and we talk all things Georgia. I am your candidate for the United States Senate right here in the great state of Georgia.
And folks, that is a great show. I do a little. She gives me about 30 seconds or so to say a few things.
10 minutes.
Well, whatever. And but it's a very informative show, and her partner in that show is great. So check that out, Tamara for Georgia. Go to that page and watch the show on Saturdays at 10 o'clock Central Time, 11 o'clock Eastern Time. Right?
Yes, sir. Absolutely.
Tamara, muchas gracias. Thank you so kindly for being here with Politics Done Right as usual, and I'll see you in a couple weeks.
See you in a couple of weeks. Thank you. Everybody stay safe.
Take care now. Bye bye.
Bye bye.
All right, folks. It is time now for us to move on to the rest of the show. Look, I understand where Tamara is coming from. That's her industry. And not only is it her industry, but she believes that, they've been trained enough to work with people that may be infected and otherwise. That is fine. I have to look at things, the bigger picture. And the bigger picture is not a pretty picture. And I know we all want to be as positive as possible. But I want to show you, before we get to the doctor that we are doing today, I want to show you an article. And let me see if I can get to that. Well, let me go ahead and pull up that article. Because what's happening here is sad. Americans are being asked, there's a pandemic that they're not responsible for. But at the same time, they are being asked that you must now go to work, do things as if nothing happened before, because we need you to, irrespective of your health. If you go ahead and visit our blog site, I kind of copied not copied, but pasted an article from Common Dreams, and I want you to take a look at this. If you take a look at the Common Dreams article, the title was Pathetic. Trump says no to additional COVID-19 stimulus checks. Backs cutting tax that funds Social Security instead. Okay, no, it shouldn't be crashing now. I still see everything working fine, Mr. Rudnin. So please tell me if you're having issues or not, but it seems to be running fine on my end. But anyhow, so what is it saying? What is Donald Trump trying to do? What are these people who are saying, we don't want to give any more stimulus to the average person, though we will give stimulus to the people at large? Let me tell you what's going on here, folks. In effect, the government is telling you that in order to coerce you to go to work, whether it is safe or not, we are going to starve you into going to work. We are going to make sure that you feel maximum pain in order to go to work, even as we cannot protect you, even as we cannot keep you safe. when you think about it, here's what he's saying. I am not willing to give stimulus money. I'm not willing to give that 1,200 was just to tie you over. But I'm not willing to give you any more. And the reason I'm not willing to give you any more is because, but I'm willing to give you something that sounds like I'm somehow nice. I'll give you a deduction out of your the taxes that you would normally pay. Thank you, Roberto. I'll give you back if you go ahead and go back to work. I'll give you back some of the Social Security payments that you normally make. That's the money that I'm going to give you back. So in order to get that other bit of money that you've earned anyway, you have got to go into work, safe or not. He passes a law to meat packers, meat cutters, all the butchers in these factories. I'm ordering you to go back to work. But can I keep you safe? No. But what else come with going back to work? All right, these are private corporations that should keep you safe. So what do they want to do? They want to protect these companies who won't necessarily keep you safe because the advice that's given to these companies are not advice at all, or rather are not commands at all. They know how to, you notice how in the previous segment Tamara talked about they were trained on how to keep people safe. Well, the CDC, FDA trained factories as to how to keep their people safe, how to make the food supply safe. Now that COVID is here and the president is ordering people back to work, can't really do that, but he wants to give these companies protection. In other words, if they give you an unsafe environment that causes you to get COVID-19, they want to absolve the corporations of all the responsibility that comes with that. You see, middle class folk, Americans, the worker, you cannot win under this system. Because you know what? Those corporate executives, they get their breaks. Those corporate executives, they can go get the loans that eventually gets forgiven. So here's the deal. The corporate executive can do the following. Okay, I will go take out a loan so that I can keep you on the payroll, and then I'm going to tell you, hey guy, come, you got a job, you got a job. I don't really have to keep you safe, but you got a job. I got money to pay you. People, you have to understand the con. And you always lose if you continue to support politicians that provide policies that does nothing, the policies that do nothing for you. Policies that does not give you, a policy that does not give you Medicare for all. They're asking you to come to work with the potential of getting sick without telling you you will have your health care without getting bankrupt. That's what they're telling you. Go back to work. But are they willing to give you health care for the rest of your life? No, they're not. You get health care? Oh, you're nice. Good for you. Are they willing to protect your kid if you take home a piece of COVID-19 with you? No. No family leave. No family, no child care. So what I'm saying is all of you who supported these particular candidates who, whenever you say the following, you say, okay, there's a particular candidate that wants to give you Medicare for all. They want to give you a Green New Deal so you can breathe. Look at how beautiful Paris looks now. Look at how beautiful LA looks now. Look at how beautiful downtown Houston looks now. Because there is so much less smog. Because, in effect, what we're asking to do is if you're going to burn some fuel, make sure that you burn it cleanly, right? And whether it's done possible or not, of course it's possible, but it costs more. But you live. Because right now, as we breathe the dirty air, we get sick. And it's not the companies who produce the toxins in the dirty air that pays for that. You do. So what I'm trying to tell you folks, if you are sitting down buying the arguments whenever a politician, Democratic or Republican, tell you, we can't afford it, it's a lie. They are always able to afford giving the money to the top. The $3 trillion that was given to the top, if they had given a $1,200 check a month to every American, it's still wouldn't equal the amount of giveaways they're given to these corporations who ultimately end up in the hands of the shareholders and the executives. Do the math. Do the math. So what I'm trying to tell you people is this. We don't have a lot of time. Right now they think they have us behind the barrel. That is what Trump is doing. The reason Trump doesn't want to give look, Trump has a decision to make. I want to show you something, guys. He can give a stimulus. But if he gives a stimulus by election time, meaning when I say stimulus, I mean UBI, the basic income, universal basic income, he can do that for 4 months. But he doesn't want to do that because what that does is it tanks the calculations that they do. The GDP will tank. It'll look horrendous. People would be living fine, but the GDP would tank. People will wait till something gives them reason to go back to work safely. He doesn't want to show that he's leaving, that during the election he has 20 to 25% unemployment or more. Doesn't want to show that. So what he wants is he's looking at the numbers. He doesn't care about you. So how is he going to get you back to work? He's going to starve you back to work. I am going to make it so painful for you to stay home that it's less painful for you to run the risk of getting coronavirus. Okay? I am going to make it more painful for you. To which I say, take some pain and let's help each other, but screw them and do not go back to work until they come up with policies that protect you, because you're rolling the dice. For every 100 of you, a certain percentage of you are going to die because they sent you back. I want you to think again. I want you to think clearly. The bet Trump is making, the bet Trump conservatives and neoliberals are making, is that they are going to cause you so much pain that you are going to go to work with all the risk and risk your life. But you're not only risking your life. People may say, okay, only 4 out of 100 are going to die. Okay? So I can take that risk. But probably 50 out of 100 are going to get sick. And of that, you know who is going to pay that bill? You are. And if you get sick enough, if you're part of the 18% that get lung involvement, if you're part of the 18% that has to be, the 10% that had to be on a ventilator or whatever that percentage is, you know who pay for that? You pay. And more than likely, you pay with your personal economy, with bankruptcy. But let's go further. For those of us, if we don't use this time to have more than a systemic change to America, let me tell you what else is going to come down. Coronavirus has been very expensive. Corporations don't like to lose money. Corporations don't like to say, oh my God, shareholders, you're going to be without any dividends for 3, 4, 5 years because of what coronavirus did. They don't like that. So what they have to do is they have to recover all the damage that occurred in 2020. And to recover the damage in 2020 and beyond, that means insurance rates, because it's a private company giving you insurance for healthcare, and the only place they can get the money for to pay their shareholders is you. Guess what they're going to do? They're coming for you with a 40% increase in health insurance, my brothers and my sisters. Don't be fooled into thinking that, one of the things about that they bet on. The corporatocracy bets that you are just short-sighted. They bet that you're not going to go ahead and think things through. And because you're not going to think things through, they will be able to do as they please with you. And what I'm telling you is you can't fall for the con. You cannot fall for the con. We have to go out. We have to support each other. And those that are staying home, when they're hungry, those of us that have that extra food, we have to throw it their way. But we need solidarity for those who are staying home to stay home. We are going to show them that their pain has to be larger than our pain because they cannot survive without us. We are the ones that cut the meat. We are the ones that stock the shelves. We are the ones that pick the food out of the ground. We are the ones that do everything. And they're betting that since our currency to exchange food for something else is money they create, that somehow we are subservient to them. Cut it out. The power is you. But you in separate homes, separated and fearful, is what we in this private, or what should I call it? We in this independent media space have to try to break through and get through. That if we stand together, what immediately occurs is they have to do what? They have to go ahead and mitigate the real issues. So if those meat packers go out there and say we're not doing it, and they offer $4 more and we say we're not doing it, and they finally say the only way we do it is if we are guaranteed health care for life. You see, you are in command now, you just don't know it. Because you know what you showed? You showed them that without you, they're nothing. Look at what's happening to the oil markets. Don't look now, but after you get off this show, take a look. There's nowhere they're producing so much oil, and so much oil isn't being burned into the air that they can't find places to store oil. They're storing oil in boats, in tankers. They're storing oil in every single country that has an extra storage plant, a storage container. They're storing oil because they don't want to stop the pumping, right? Because when you stop the pumping, sometimes to restart is a big issue, right? You are in command, folks. If I could get that in our heads, we could work together and say, no. Medicare for all, forgiveness of student loan, then we go back to work. You see, it is for us to bargain now because we've shown them where the power lies. And the power lies with us. You know what? They could say, okay, well, we'll just shut the factory down and nobody goes to work. Yeah, and you starve. And then the pitchforks come. Or if you decide, okay, we're not going to do it anymore, we get politicians in that says, okay, if you don't want to follow the rules, nationalization. It's that simple. If these corporations try to hold hostage the American people, we the people, then we take it. And that is what we have to learn deep inside. We have to learn what temporary pain. You see, they've made us very soft. They've made us fearful. Oh, we can't really do that. Well, you know what? There are more of us than them. A hell of a lot more. And that is what we have to realize. But anyway, I have, as far as opening or reopening the economy, I spoke to Dr. Shannon. I can never say his name correctly. So anyhow, what I'll go ahead and do, and I'll go ahead and play him now, and then we'll go ahead and take it on the other side. It's interesting because as we crashed, it turns out that his piece didn't show up, but here it is. Here it is. Welcome to another segment of Politics Done Right. I'm here with Dr. Shannon Sovndal, medical doctor, and we are going to discuss the issue with COVID-19 and opening up the country. Not like the country was ever closed. It was closed for everyone else except the essential workers. Well, turns out that Dr. Sovndal is an essential worker. Dr. Sovndal, welcome aboard Politics Done Right. How are you doing today?
Hey, thanks for having me. I'm doing well. Thanks.
Well, look, let me tell you, first of all, I just want to hear your general impressions about the president deciding to sort of force feed to the states that we need to get people out there going to get this economy going. What's your general thoughts on that?
Well, I mean, I think we're playing with two parts of a puzzle, right? The first part is we're trying to protect the public from COVID-19. We're trying to flatten the curve, as you've heard ad nauseum. We're trying to slow the spread. But at the same time, we do need to have the country functioning. We need our economy functioning. If we don't have that functioning, then there's certainly ramifications from that, and those could be health ramifications as well. So we have to look at both sides and kind of cautiously move forward. But at some point, we do have to move forward.
Now, I know that we have to move forward, but in order to move forward, there are a whole lot of steps that we need to take before we can actually do that. And one has to decide if these are state-based methods or is it going to be federal methods, et cetera. What are your thoughts? First of all, what would be these steps that one would have to take to do that?
Yeah, if it was up to me, I think that we need to have a strong leadership present, and that's from the top on down, meaning guiding us on what's the plan and how are we going to do this. That needs to revolve around extensive testing and retesting, meaning we need a lot of tests, way more tests than we have available. We're talking millions of tests a week that we're doing to order to get a real idea of what this virus is doing, how effective it is, where we stand in the response curve. All of those things, we need to base it on data, and we need to base that data on testing. And the frustrating piece for a lot of people is the models, and everyone's saying the models are wrong. This one overestimated, this one underestimated. The models are actually good. They're good pieces of equipment and good tools. The problem is the data numbers that we're putting in. That's where we're lacking. And the only way that we can get those numbers is to really do massive testing and get an idea of where this virus sits.
Yeah, I think a lot of people don't really understand models. Models depend on the inputs that you put into it, and not only that, but it can change if the inputs actually change. In other words, we all stayed home for a while, and by staying home, we mitigated the infection rates, et cetera, et cetera. Now, what's your thoughts on how we handled this in the first place? I know you're aware that this virus was known back in November, if not a bit before.
Yeah, I mean, I think, in hindsight, it's always easy to look at things because you don't know exactly the way they're going to pan out. You can look at the models, like we said, some, overestimate the fatality rate, others underestimate it, and we just don't know. I think that from a standpoint as a physician, it is good to be conservative and safe, and better safe than sorry. I think it's very appropriate early on to take a time out, essentially say, hey, we need to have everyone stay at home so that we can figure out what's happening with this virus. If we don't know those numbers, that was really the time to figure it out, was to say, let's do a lot of testing right now, early on, and then we can get an idea of how it's going to shape out as we move forward.
Now, it's not first of all, a lot of people say it's not the good time to start assigning blame. To some extent, I agree. From a political perspective, however, I understand that if one doesn't start to do it at just the right time, mistakes are, one goes ahead and repeats the same mistakes over and over again. What would be your advice as far as let's go ahead and start looking into the past? In what manner would you do that?
I mean, I think that you always want to know when data was available, how that data was delivered, who was delivering the data, meaning up the chain of command through not just the federal government, but in the states as well. And we even deal with that, at a hospital level. So it's kind of at all levels, you need to say, hey, when did they have information and how was that information acted upon?
Now, Doc, you are a board certified emergency medicine doctor, which means you're out there. You are in the middle of the field, in the middle of the fire. Why don't you tell me a little bit about some of the experiences that you saw? I want people to understand that this is not some sort of an antiseptic virus or an antiseptic being. What I'm seeing around a lot of the world who haven't been hit yet sort of need to know what doctors like yourself and others in the Midwest, others in the middle of the country are eventually going to be walking onto.
Yeah, well, I mean, we can start by, with our previous comments that we don't necessarily know the numbers of this virus. Meaning we don't know the denominator, we don't know mortality rate, we don't know all these things. But we do know what the hospitals were experiencing in New York City. We do know what really hard-hit areas we're experiencing. And that's really what we have to base our moving forward on, is to say, yeah, I don't have the specifics, but I do know that we don't want to be another New York City in a different, geographic location. And so really from a frontline standpoint, early on, we were worried about a couple things. First is, how do we protect the staff? So how do we make sure that those providing care have the appropriate equipment on? And then how do we interact with, the patients that are coming in? the tricky part of the emergency department is it's always a bit of a dangerous place, meaning we don't know who's walking through the door, right? And we can get exposures of different diseases. We can catch hepatitis, HIV. We can have a combative patient that, attacks us. People can even have tuberculosis and things like that. So we're kind of at baseline ready to deal with some of those threats. The problem with this, in part, is you didn't always know who had it, and we don't know how prevalent the disease process was, meaning that I could have someone check into the ER for one condition, and it turns out that they might have COVID. And a great example of that is, I had a patient that had kidney stones. He came to the ER for kidney stones, and I did an imaging study to look for his kidney stones, and on that imaging study, we saw that he had ground glass appearance, both of his lower lobes and his lung, which is really kind of prevalent in COVID patients, right? And so this patient was not complaining of COVID symptoms. This patient was complaining of a kidney stone, which he had. And so that makes it difficult from a frontline standpoint, meaning very early on, we had to assume everyone had the disease. So that's why you see providers with their PPE on. And, essentially when you put that PPE on, you wear it for the whole shift. I put it on and I don't take it off. The risk is putting your hands to your face, moving that equipment back and forth. And so I really want to limit that. So it's kind of, having strong vigilance that everyone has the disease in the way that we approach the patient, and then being really careful with your protective gear.
Now, tell us a little bit about this mission, because now that you mentioned the protective gear that you have, the average person that's doing their exercise, even though they're home, they're running on the outside, they're doing a whole lot of things. How much more safe do we need to be? Can we run on the outside? Can we go to the grocery stores? Give us a lowdown on that.
Yeah, so again, there was a lot of talk early on. This is a droplet-borne virus, and what that means is it's droplet particles. It's particles that get on surfaces, and then we touch those surfaces, and we touch our mouth, our nose, or our eyes, and that's how we get it. It can be put into the air. For example, if someone sneezes, if I sneeze in the room and you're in that room, I throw little particles in the air. That doesn't mean it's an airborne virus. Mm-hmm. That just means those particles were spewed in the air by someone sneezing. And really what we're trying to do with social distancing and masks is we're trying to get a herd protection from this. If we stay 6 feet apart from each other, if we wear a mask when we're out in public, that means that whenever I sneeze, I'm kind of blunting that spread of the droplets. And if everyone does that, then we really can kind of get a handle on it. And my thoughts on this as we move forward is I would like to start opening things up, but I would also like to do it very cautiously and reasonably. And that, as we said, involves a lot of testing, but it also involves continued social distancing and wearing a mask. That would be my recommendation. Until we know exactly what's going on, let's just be safe. That doesn't mean that you can't go out. It just means I'm going to attempt to stay, away from people. We're not going to be in large groups hugging and doing our normal greetings. You wear a mask when you're out in public. If you need to, even go and get some food somewhere where you can move away from someone and wash your hands and take your mask off, eat your food, but then put your mask back on. And that will get us moving back towards normalcy, but it will also do it in a conservative way until we know for sure, where we're sitting with this virus.
One last question about COVID-19. I understand that they're finding out that it's expressing itself in a lot of different ways. Now, I just read that now children may be getting some sort of a shock syndrome, inflammation type syndrome from it. I had a cousin who's a detective in New York who got it, and it turned out he got some blood clots and got a stroke. But he's getting much better from the stroke. And of course, we know the pulmonary destruction that you have. What's the for those who make it through, which is most people do. What's the condition that their bodies are left in? Pre-existing conditions, which would later affect their insurability. What are we looking at?
Well, I mean, all this is really interesting item standpoint, but again, it goes back to the needing to know how prevalent the disease is and how many people have this. And the reason why is because if we have a very prevalent disease and we say everyone has COVID, and then we look at patients who have strokes or complications, that could be just because a large number of people have the disease, and ultimately some of those people are going to have strokes and other problems. We also need to look at it from a standpoint, well, if I know the number, then I can say for certain that strokes are much higher in patients that had COVID, and I can start to identify those problems. Again, when you go back, I find that all those things are very interesting, but I don't have a scientific basis yet to tell you what the risk is of having blood clots or strokes or heart problems after the COVID, because we just don't know the numbers yet. Certainly, all of that needs to be looked into, and I'm anxiously waiting to get some data so that we can look at those things and get a clearer picture as to what the risks of various disease entities are once you have COVID-19.
Dr. Sandoval, I respect that. I respect anybody who's able to say we don't quite know. So I do appreciate that. Now, there are two reasons I wanted to bring you here, specifically to talk about opening up the countries and the risks that we're taking. But the other issue is that I understand that you did this. You wrote a book called Fragile. Tell me a little bit about this book. It seems quite interesting from what I haven't read it, but I saw it on the website and said, it seems like a pretty personal book. Talk to me about it.
Yeah, so it's called Fragile: Beauty and Chaos, Grace and Tragedy, and the Hope That Lives in Between. And when you write a book, it starts years ago. I mean, I started writing this book 8 or 9 years ago, and then you decide to publish it about a year ago. Whole process going, and then it turns out that you're releasing the book in the middle of a pandemic, and it is odd and crazy, the timing. I think it's odd and crazy the fact that I'm wearing a mask on the cover of the book, and we're in the middle of a pandemic here. But really, it just drives the point home of the book, the fact that we're in a pandemic. And really what that is life is fragile. At any moment, you can lose everything that you have. Everything that you thought was normal can be turned on its head in an instant, right? And we know that from having a heart attack or having a car accident. And now we all know it, not just you and me, and not just the United States, but the whole world knows it, because we have a pandemic that just turned everything on its head. And really what we're talking about is having a realization that life is fragile, and oftentimes it's beyond your control. That might seem very scary and daunting, but really what fragile is resiliency. It's about how do you look at how that affects you, the fact that the world is fragile and these things can happen, but how does that open up your life? And certainly from my role as a doctor over the last 20 years, it's definitely changed the way my outlook is on life for the positive, meaning I feel so much more deeply when I come home and hug my kids, or when I get to go on a dance with my wife or a date or whatever the case is, right? I get to have this emotional feel because I've seen the other side. I've seen how devastating things can be. So I get to live in the moment. When I have a good moment, man, I really embrace that for all that it is. And right now we call this the great pause, right? The pandemic's this great pause that we have. Yeah. And what an opportunity for us to really evaluate what's valuable in our lives and what's important. And stop asking all the whys. Why does this happen? Why is there a heart attack? Why is there a pandemic? That's the wrong question, right? We need to ask who's in our life? Who are we trying to connect with? And really, it's the bigger picture of the why. Like, what is my why in living?
Let me tell you, Doc, that's pretty wise. I mean, as it turns out, I've been talking to a whole lot of people about what this really means. And it's amazing how it's really connected a whole lot of people. People see that they can do with a lot less. People see that, there's a whole lot of new things people are discovering now, which makes it that we will never be the same again. And that new normal doesn't mean a worse or a better normal, but just a new normal. So I enjoyed that. Give me a closing statement before we go. Before that. Tell me, first of all, how are you holding up with all the pain that you're seeing in these emergency rooms, and how are the nurses and the janitors? And because people have to, what I tell people all the time when we talk about essential workers, you're essential. You're a doctor. You're saving people. Your nurses are essential. They're saving people. Those janitors that are cleaning those floors are essential. Those secretaries and everybody else that's doing that work, they're essential. And their work is valuable. We couldn't do it without them. Tell me how you see them holding up in these areas that you're at.
Well, absolutely. I fully agree with you. My hat off to everybody who's a first responder and on the front lines working. And that's everybody that makes the system work on the front lines. We couldn't do it, like you said, without the janitor, the EVS people, the people at the front desk. We need all of those people to make this function. And what I've been very impressed with, they all are showing up to work. We don't have mass call outs. We have people stepping into the fire saying, I'm going to go to work. I'm going to take care of everybody. And it gives me a real sense of pride that I'm part of that team overall, that they're doing that. And we have a thing in our neighborhood that is the 8 o'clock howl. So people howl for first responders at 8 o'clock.
Nice.
And it's moving. I go outside and I hear neighbors, howling like wolves outside, giving their support to first responders. And I think that, it is hard work. It's hard to be in the PPE. It's stressful because you're worried that you could get sick. You're worried you can bring it home to your family. I'm exhausted when I come home, really just from wearing the equipment and being worried about it. And I do have concerns that 6 months from now, the stress is going to catch up to people, right? We're really good in the moment. We're good fighting through the moment, but there is some cost, and you're going to have to deal with all this stress and pressure that we were feeling. And, I just would really push out there to keep offering your support to the first responders, talk to them. And if you are a first responder or hospital worker, talk to each other about it. Talk about the stress you're having, how you're, feeling stressed at home, if you're arguing with your wife or whatever the case is, right? This is real life stress that's on you. And the sooner we can, start opening up about it and addressing it, I think the better off we'll be.
Dr. Shannon Sovndal, MD, thank you so kindly for spending this time with Politics Done Right. We didn't really go into politics, but I think right now this is much more important. You have a wonderful day.
Yeah, thanks for having me.
Okay, I hope you enjoyed that. You know what's touching? You notice something that he said. All those first responders came in to work. They came to work. We need them working. We need the grocers and all of those that are working. Essential workers that are working. Those people that are saving people's lives, we need them. But we need more. And that is, we want to thank those guys, and we want to fight for those guys. And we can fight for those guys that are working their butts off by, in our case, staying home for two reasons. Staying home, mostly not to spread the disease around, because again, those essential workers are doing very hard work to maintain themselves safe. But the second reason to stay home is if they tell you to go to work into an unsafe position, it is time for you to go ahead and say, no, we're going to negotiate. We're not going back to work until we have health care for all, Medicare for all. We're not going back to work. I know I repeated that earlier, but we have a new set of people coming in here. What I want folks to realize is this. At this point in time, you are in command. Do not cede it. Do not cede your power now. Because right now, the corporatocracy is positive that if you don't start driving your cars again, the oil glut would be permanent. If you don't start shopping again, you are going to destroy the entire supply chain as they know it for those who profit immensely from it, not you. So what I tell you, it is time for all of us to get busy. Okay, let me see what time it is. I think it is time for me to go ahead and start reading the quotes here. Earlier, for those who are just joining us, we earlier had a crash, so we had to restart and get busy again. So let's go ahead and do that. Let's see. Michael Rudnin sent round 2. Sharon, thank you, Rudnin. I can always count on you, my brother. Michael Garcia, what are you doing to buy when you have no cash and no credit, and every dollar you have, you need to eat, pay rent, and try to get... I mean, that is so true. And that is what we have to mitigate. That is why we need a social safety net, Michael Garcia. That is the reason why we have to feel some short-term pain to force these guys, because again, they can't exist without us. Without demand, there is no supply and there is no economy. Welcome to the next year at least, and likely longer. Wages have not risen for 40 years. Okay, I want 40 years and you have been living on credit card debt. No more. Exactly. But let me tell you better. We haven't been making any more money, but those on top have been collecting all that money that was really due us. Remember that. Remember that there was money to be made. We just didn't get it. Let's see. Michael Rudnin said it's okay again. Roberto Lewis, welcome aboard, my brother. Okay. Rudnin says, when Trump and Congress tell us to go back to work before a vaccine is ready, a general strike will follow. People will continue to stay home. People's health is more important. That is what we can say right now, Rudnin, and that is what we have to encourage other people to do, Rudnin. But there's another thing that we have to do. People have to eat, and we don't want them to be starved into going to work. And that's where I tell you, we have to be each other's keeper. Those of us who have extra food have to be ready to help those who don't have. And I'm not talking about exchange of money. I'm talking about we are going to have to, those of us who have some food laying around, in order to keep those other people home for the better good, so that we can make sure that they don't screw us once again. Yeah, we are going to have to learn how to be our brother's keeper. I intend to do my part. That's a promise. 30 out of 100 will get sick. Thank you for letting me know the right numbers, Michael. That 30 out of 100 will actually get sick, and all of those will have medical bills. Lawrence Sim says, how many military jails on streets are not being counted? So true, Lawrence, so true. China just bought an oil field in the Permian Basin. Doesn't surprise me at all. They're the only economy that's going to do well. And that one of the things that they're an economy that they could force everybody to stay home, beat the crap out of you if you don't stay home. I mean, just a brutal society in certain areas. Bruce says, student loans, is that equitable? Will that relieve the ghetto? And then Raymond Johns responded, it won't relieve the ghetto. The models are unrealistic. They assume a return to baseline, which is wrong. But I want to correct one thing, Bruce. Giving student loans won't fix the ghetto, but it will fix a lot of people who will help the ghetto. All right? There are a lot of people who, if you go ahead and forgive student loans and say, for forgiving your medical debt, for forgiving your student debt, you are going to be working to improve society. Yes, it can help in that regards. Secondly, we're not only talking about forgiveness of student loans, right? We're also talking about tuition-free college for everyone. And therefore, yes, that will help the ghetto as well, the barrios and Appalachia. So what I'm saying is, not because a particular group are the ones who generally take care of. You know, that is an argument that the right wing wants to use, right? The right wing uses an argument that says, don't be talking about forgiving the student loans because you're helping rich people, because who goes to school? Who goes to college? Most of the more wealthy people go to college. Of course, that's not completely true, right? I mean, that's not completely true. But they want to stick that divide in there so that, well, that is how they mitigate having to pay off those student loans that these bankers have been ripping people off of for years. So they try to pit the poor against the poorest. All right? Let's not do that. Forgive all the student loans, and we can have the forgiveness of student loans with some mitigation, and that mitigation being, okay, if we forgive your student loan, you're going to go ahead and make things better for others. Meaning you work in the ghetto, you work in the barrios, you work in Appalachia, and you get your student loans forgiven. We can actually do things like that. All right, let's see. So I would put student loan forgiveness as maybe number one, maybe eliminate the interest. Yeah, you eliminate the interest, but I want, again, here's the thing why I want it just gone. If we had corporations and the wealthy pay the taxes that they normally pay, we would not have had to have those humongous large student loans at all. Because we are asking people to cover their education to go work for corporations who then, again, the corporations don't want to pay to educate the people. So you borrow money to educate yourself to go work for the corporation who doesn't want to educate you. So they make money on both sides. They make money loaning you the thing, and they make money by getting a freely educated person into their domain. And then they make a profit off of your excess labor. It is a racket, but the problem is we don't generally explain it in that manner. We explain it as if they're doing us a favor for hiring us. They're doing us a favor when they pay taxes to put us through college. There is no favor here. It's an exchange. It's an even exchange. We just have been at the short end of the exchange because it had not been even. And how do we know it's not even? Because money is trickling up to the top. You see, you can't hide reality, right? And that's what reality tells you. Jeffrey Owens, what is being used? Study technology. Michael Rudden says, nations where everyone wear masks have lower case of infection. True. All right, Derek Bell says, missed it. Mostly keep up the good work. Thank you very much, my brother Bell. Governors treating people that I'm going a little bit over because remember we had that crash, so we lost about 7 minutes. Governors treating people, threatening people that don't go to work to take their unemployment away. Stay home until it's a safe environment. Exactly, stay home. Bruce says, first off, if it shouldn't be a picture of a student, you don't pay them until you're out. But waiting is good. However, I think we need to spread the money around to give everyone a chance to make a better world for their family, college or not. I agree with you 100%. I don't think what we're saying is mutually exclusive, my brother. Jeffrey Owen says, remember the robot Sophia and brother Sirius? Okay, Jeffrey, you're going to have to talk to me about it another time. The Holy War 5G. Okay, Derek Bell, everyone get out and vote Trump out. No excuses, period. That 1 trillion tax cut sure is biting us all in the butt. True. Let's see what else really. Derek Bell says Trump not wanting another stimulus check and wanting to get rid of payroll tax. That will gut SSA and things for our seniors. But that's not the only reason he's doing it. It's a bribe. In other words, I am not giving you any more stimulus. But if you go back to work, I won't take out the 7.25% Social Security, so you'll get a little bit more on your paycheck. It's a bribe. It's a bribe that guess the only person who's paying for it is you. Because the Social Security that is giving you back comes out of your income that you made anyway. So it is not the way to look at it. Anyhow, I want to show you a little video before I go. This video just shows the power of the presidency. Everybody gets, many people get mad when I said that the Constitution had some defects in it, right? It was interesting to watch somebody else, a professional constitutional scholar, pretty much say the same. It made it that the president has too much power. Of course, if you get a united Congress, you can mitigate that, but that sure is not what we have. Check this out.
When Americans are asked to make among the most important and difficult decisions of their lives in the coming weeks and months, they're going to decide whether to, and I've said this over and over again, whether to go see elderly parents, whether to put their kids back in school, whether to go back into the workplace. And it will be a luxury, I should note, for any of those decisions to be a choice. A lot of people will be pushed into those. Where do we look? I mean, we have a White House that is what it is. We have a liar in chief who's pushed hoax treatments, who's diminished his scientists. We have a VP who, for some reason, doesn't wear a mask because it obscures his vision or something. I mean, where do we turn?
Well, the problem, Nicole, the founders tried to make sure that presidents did not have too much power, and unfortunately, they failed. Presidents have overwhelming power nowadays. So if Donald Trump, for instance, opts to do things that help the economy come back at the expense of much higher death tolls, he's got at least the legal power to do that. And all we as a society can do is criticize that if we disagree or talk about other scenarios. You know, this is the 45th anniversary today of the day that we lost the Vietnam War in 1975 with those more than 58,000 people killed. That was largely the result of mistakes that were made by two presidents, Lyndon Johnson and Richard Nixon. No matter what else they might have done that was good, had someone else been president during that period, you would have had a lower death toll, and Vietnam would be not such a blot on American history. And historians in the future and future Americans are going to ask the same questions about Donald Trump.
I'm Egberto Willies, host of Politics. Absolutely so. Anyhow, so I hope you understand what he's trying to. Two things that come out of that. One, Nicole pointed out that he's a liar in chief. Two, Nicole pointed out that some have the luxury not of having to go back to work, but she understands that some people are going to feel that they have to. And what the professor pointed out is just how cruel this president is with the power that he has. But you know what? There's still more of us than of them. So remember what we spoke about earlier. Anyway, folks, this is a show that needs your support. So I ask you so kindly, visit our store at store.politicsdoneright.com. That is store.politicsdoneright.com. Most of all, what I would love to implore that you do is you become subscribers of Politics Done Right. How do you do that? Go to patreon.com/politicsdoneright.